Hello, everyone. Welcome to McGill Cares, a webcast series addressing a wide variety of topics to support family and informal caregivers. I'm Claire Webster, a former caregiver who became a certified Alzheimer care consultant and founder of the McGill University Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee this program, who include Dr. José Moret from the Division of Geriatric Medicine, Dr. Serge Gauthier, McGill University Research Center for Studies in Aging, and Dr. Gerald Freed, McGill Steinberg Center for Simulation and Interactive Learning. Today's webcast is made possible thanks to the Lindsay Memorial Foundation. So today we will be discussing when coping mechanisms become addictions. My guest is Dr. David Luckow, a family physician at the Montreal West Island CIUSSS in their youth mental health clinic and a clinical lecturer at the McGill University Faculty of Medicine and Health Sciences. He is the head physician at the Centre de réadaptation en dépendance de Montréal, a public drug and alcohol rehabilitation center. As a certified medical review officer, he provides drug testing, reviewing services, and independent medical evaluations. Welcome to our show.
Thank you.
I'm very happy to have this subject today, which is really an important one. How has the pandemic impacted, people's addictions, people's coping mechanisms, due to anxiety and other issues?
So when people aren't feeling well, people want to feel better, and so they do actions and they take steps in order to make themselves feel better. Sometimes these activities can be less than healthy and less than ideal, and it can include using drugs, using alcohol, or using doing other behaviors that can be in the short term make you feel better, but in the long term make you feel much worse.
Mm-hmm. So I'd like to talk about the whole notion of addiction. Like, what are some of the most common addictions? Because I think when we say the word addiction, the words of alcohol and drugs first come to our minds, but there's a whole other slew of addictions, aren't there?
So probably the more common addictions out there would be tobacco is number one, alcohol is number two, cannabis is high up there. Other addictions that are out there, I'm actually going to add cyber dependence as online addiction, certainly over the past probably 10, 15 years, and certainly over the past 1 year. But then we also have all the other substances, heroin, cocaine, other substances that we can use that can all generate a sort of a feedback cycle between your reward, and you use the substance again, you get a better reward, makes you feel less bad, so you do it again, and then you get into trouble.
And then there's also, I imagine there's addiction to food, addiction to gambling, addiction to sex, like those are all.
So addiction to gambling, absolutely. Gambling disorders, absolutely. Addiction to food, although we can have disordered eating and we can have addiction to sex and you can have disordered sexual activity, and they are definitely related to the world of addiction in the sense that it touches the same areas of the brain. Their manifestations are somewhat different in large part because of what is considered societally normal or not normal, and also because those actually fall under more behavioral addictions as opposed to chemical addictions.
Now, would you say that like almost everyone has some type of coping mechanism? Like, so for example, for my many years, I mean, I'm going to be 53. Wine has been, I had a love affair with wine for 33 years of my life. And, that was my coping mechanism, but other people may have, coping mechanisms with regards to eating when they're stressed or going and shopping. But do most people have a form of coping mechanism?
Everyone has coping mechanisms. Everyone, let me rephrase that, everyone should have coping mechanisms because we all have to deal with ups and downs in lives and we all have to deal with them. Mm-hmm. The question is really, when do those coping mechanisms morph into an addiction? And mm-hmm. that's where sort of we cross a line, and then we go from saying I can go out with my buddies and have a beer at a bar and say that's fine, versus I have a serious alcohol problem and now the alcohol is very reinforcing. Or I want to go shopping online, or I want to window shop and I feel a little bit better, versus I've just emptied my bank account because I've compulsively bought a whole lot of extra things that I shouldn't have bought. So when does it cross the line? That's where the coping mechanism morphs into more addictive behavior.
So what are the biggest warning signs that people should look for in terms of, realizing that this coping mechanism has a potential to become an addiction?
When things start to go sour, it's nice to say that, but then that requires people to have an auto reflection to be able to look at themselves. And sometimes that auto reflection is very evident. Sometimes the auto reflection is not, where the individual thinks, I don't have a problem with said substance. But it's everyone else around that person who thinks that that person has a problem. When people close to you start saying, I'm a little bit worried that you're spending too much time doing this or spending too much time doing that, that's a red flag. When your doctor or your therapist says, I really think you should stop using, and you don't, that's a huge red flag. When you're starting to impair your health, when you're impairing your finances, when you're impairing your job, when you're using something that's putting yourself in danger or somebody else in danger. These are things that should raise red flags either to yourself or to the people around that person to say, this is not just a regular coping strategy, this is moving into the world of addiction.
Is there this kind of a cycle of, I had gone through it. As I mentioned just before coming on our webcast, I've been 10 months sober because I recognized in my life that wine had been too much I had too much of a dependency. And unfortunately, in my case, it took a significant health crisis, to make me really wake up. But there's this whole cycle that I think people may go through where you wake up, whether you're hungover or feeling guilty because you've shopped too much or you drank too much. Then you go through this period of absolute shame. You promise yourself that you're never going to do it again, and then lo and behold, later in the day, the whole cycle starts over again. Is that common for most addictions, that feeling of shame and regret?
Absolutely. And the idea of feeling bad about yourself, the idea of shame, regret, guilt, these are some of the diagnostic criteria of addiction because just as you say, the substance is used, the person feels good temporarily, then the person has consequences of their usage. They feel bad about what they've done. They wish they hadn't done it. They say, I've done it before, so gosh darn it, why did I do it again? Obviously, I'm missing something here. But now that I feel bad, I want to do something to make myself feel better. And I know that if I use the substance, I'm going to feel better. So I'm going to use the substance. And then the cycle goes around and around. Now, sometimes it's a very conscious, sometimes it's a very conscious cycle. Often, though, it's a very unconscious cycle. It's a subconscious cycle that people aren't actually thinking about that. And it's like, I don't even know what happened. And I'm at, gosh darn it, it's 5 o'clock and I have my alcohol in me. And I don't understand, how did I get from 10 o'clock in the morning saying I'm never going to do that again to 5 o'clock in the evening that I'm here. And that's part of it's actually a very common cycle of addiction.
And so I was saying to you also earlier, for me, I can't just have that one glass of wine. And for some people, they can't just have that one occasional cigarette. So why is it that some people are like, how come I can't, but my husband can have just that 2 glasses of wine and stop? Like, what is it about me?
So, okay, what is it about you personally? I'm not going to answer that.
But why are some people like, I could look at a box of chocolate and say, I'll just have one, but I have other friends who'll say, no, I'm going to eat the whole box of chocolate. Like, What is it?
So in our brains, everyone has a reward center. We all have what's called a pleasure center, and that pleasure center allows us to engage in risky behaviors that keeps us alive And it obliges us to engage in these risky behaviors in order to keep us alive. And so specifically, it allows eating and reproduction, both of which are inherently risky behaviors. But if you don't eat and you don't reproduce, then it's the end of the line. And so the reward pathway, this reward center, is that counterbalance to the risk in order to ensure that we continue to live. The thing is that that reward pathway has a whole lot of checks and balances on it. And that reward pathway, it helps to make sure that everything stays on the straight and narrow. The problem is that when you introduce an exogenous substance, alcohol, cocaine, cannabis, tobacco, there's a chance that that substance can kind of hijack the whole pathway and just turn on that pleasure pathway and bypass all the checks and balances. Different people react in different ways. Whereas one person will smoke a cigarette, choke, and say, that was the most awful thing that I could have done. Someone else is going to smoke a cigarette and say, that was the best cigarette, I want to smoke again. And the one in one setting, the reward pathway didn't turn on at all. In another pathway, another person, the reward pathway did turn on. Once that reward pathway turns on, it's like a key in a lock. The key's gone in, it's turned, and it went click, and the door opened. Well, now that you know that key can open the door, and gosh darn it, you experience that pleasure, and you've got no brakes to say, okay, that's enough now, then you want to do it again and again and again, which then leads to the harm, which is specific to whatever substance you're addicted to, but it also leads to the harm of, it's almost like you're burning your pleasure pathway. And both of them can lead to further dysfunction overall, and in turn can inadvertently fuel, directly and indirectly, fuel the use of the substance again. So
for people who recognize that they have an addiction towards something, then there's really no such thing as moderation, for example, right? Like I know that in my case, I can't drink moderately. It's either 0 or I'm going to go and drink those 4 glasses and finish the bottle, right? So because some people say, well, why can't you just have a couple, or just, but I guess because of that key and lock analogy that you've just provided us with, there is no in between.
You take the key, you put it in, it won't turn, or you take the key, you put it in, and it does turn. It's not going to turn halfway. In medicine, there are no certainties. There are very few certainties, I should say. And to say that no one can drink moderately or use drugs occasionally and not get hooked, who have a past history of addiction, there's always going to be a few people who say, actually, I can. The problem is that the other 99% think that they all fall into the 1%. And if the 99% acknowledge that they're in the 99% and say, listen, I can't do that, that's wonderful, that's great. Now, don't take the key, don't put it in the lock, and don't turn it. But some people can actually do that. It's rare. I would recommend, and I systematically recommend to my patients, you can assume that you're in the 99%. If you're in my office, the odds are you've already tried to be that 1% and you failed, which is why you're in my office. And so you're probably in that 99%.
So can addictions evolve over time? And also, if I were to give up one addiction, is it common that I'll develop another addiction? Like you hear often people, for instance, who stop drinking, all of a sudden start eating a lot more sugar. Yep. Or, I don't know if you may have a gambling addiction, you stop gambling, but then you might go towards online shopping. Like you said before, the cyber dependence, it's very easy to, click and buy.
Yeah.
So how does that evolve?
So there's a few things that are packed into your question. First of all, does addiction evolve over time? Absolutely. So when a person is using their substance, the substance itself has the potential to impart harm on the individual. So that's specific to whatever substance that the person is using. But independent of that, the repeated usage of a substance, which repeatedly drives your pleasure pathway in an uncontrolled way, effectively burns your pleasure pathway, and your body kind of downregulates that pleasure pathway, such that at the beginning of an addiction, sometimes people say, I use it and I have fun. What's the big
Mhm.
deal? I'm just having fun. And then as time goes on, you're using the substance to feel normal because I'm just feeling normal. What's so bad about that? And then the third stage is when you say, well, I'm still using the substance, only this time I'm using it because I don't want to feel bad. And because when I stop using my substance, I feel awful. Therefore, I have to keep using my substance. And once you're in that third stage, it's hard to stop, to say, yes, you're feeling bad. I acknowledge that you're feeling bad. But then over time, that pleasure pathway rebalances itself. But it's hard to see that if you're in that stage.
Mhm.
Now, does it evolve over time from a neurological standpoint? Absolutely. Now, to answer your second question, can you say stop alcohol and go on to something else? So, just as a comment, because you mentioned alcohol and sugar, that's a huge common jump, and I would argue that that's in the short term is not actually an addiction. It's more of the body's reaction to a change in calories and a change in energy, in the sense that when
Mhm.
somebody drinks a lot of alcohol, you're putting a lot of energy into your body, and all of a sudden your body says, where's all my energy? I don't not having energy. And your body craves sweets. The
Mhm.
idea of eating lots of sugar, putting five tablespoons of sugar in your coffee suddenly seems like a really good idea. And that's not necessarily an addiction. It's just sort of a counterbalance of the amount of energy, and how and that usually within weeks or maybe a month or so can balance itself out.
Mhm.
But can you say stop alcohol and then start smoking cannabis, or stop cannabis and start snorting cocaine, or start using cocaine and then start spending all my time on lines where I'm spending 18 hours a day online? Absolutely. We call this sort of the syndrome of whack-a-mole, where you whack down
Mhm.
one, boop, and another one pops up. The other way that we look at it is we can view it almost as an iceberg. So as the iceberg, and you have a little peak sticking up, you go, there's the alcohol peak. So you take a saw, you cut it off, you throw it away, you say, awesome, we cured it. But what happens to the red whole iceberg is it moves up a little, and now all of a sudden you've got another peak over here that's popping up. And you can keep popping, keep cutting off the tips of the icebergs. It's a hard, it's a hard pathway. But at the same time, that is one thing that sometimes happens.
Mhm. Mhm. Now, I think most people who have addictions, many cases recognize that they have a problem. Okay. And I know for myself for years, I knew that I would say alcohol dependent. Like I said, it was my best friend. It helped me through my journey as a caregiver. It helped me through happy times in my life. It helped me through traumatic times. And I knew that I had a problem with it. But unfortunately, it took my own health crisis, like a significant health crisis, and in a different area, to really make me wake up and realize, Claire, that's it. It's time to change. Is that based on your professional experience? Is that normally what it takes, like a crisis in people's lives to say, okay, I need to get support now?
Yes, but the definition of the crisis is unique to the individual.
Hmm.
And the crisis can be a function of burning through time or burning through money. So a health crisis would be, I'm burning through my own timeline. That's not
Hmm.
good. I want help. A money crisis would be, I got evicted. I'm facing eviction. I got fired from my job. I can't go to work anymore because I'm so sick. Another time would be a time crisis would be youth protection got involved with my children. I've lost a spouse. I've lost a significant other. I've lost friends or family because of my substance use. So again, this affects time and money. And usually these are the driving factors that drive people to go, I have a problem, or wow, I need help, or well, I don't have a problem, but I'll get help just so that I can undo that damage there, and in the process realize actually I do have a problem.
So let's spend some time now talking about treatment and support options, because when you have an addiction, addiction is a disease, correct? So it's
Yeah.
not like, you can have all the motivation in the world to change, but it's not necessarily possible just to say, I don't have the willpower. And I think a lot of people, like even myself or others who start dry January and say, I'm going to stop, all of a sudden your willpower runs out. So
Yep.
how do you treat support addictions?
Okay, so addiction is no different than any other disease. You have the spectrum of the mild, moderate, and the severe. And the mild, the amount of interventions are small. The moderate, the interventions are more intensive, and severe, the interventions are quite significant. And so it can range from my own self, I'm going to change my own behavior, or I'm going to change things around me so that I can actually not keep using, so that I can deal with other things that I have. I can start myself, I can look at those other peaks of the iceberg and deal with them myself. In the more moderate range, I can reach out to get help. I can talk to a social worker at the CIUSSS. I can seek help from within the network of Centre de réadaptation. It's across the province. It's publicly available. People can go to Alcoholics Anonymous, Narcotics Anonymous. There's a lot of community self-help organizations that are either free, as in those cases. There are other organizations that are private. You have to pay for them, but those services also exist. And in the more intensive interventions, you can have residential programs, you can have inpatient programs, you can have detox programs, where the person's sort of physically constrained. They don't go out in the regular world. They stay within sort of the safe zone where that substances aren't available. There are workers to help the person. There's psychologists, educators, dietitians, nurses, doctors to help the people when they're in this area. From a non-pharmacological standpoint, that kind of goes the whole range there. From a pharmacological standpoint, so from a medication standpoint, there are medications that can be prescribed to help prevent alcohol relapse. There are medications that can be prescribed to help prevent opioid use disorder relapses. They can help to reduce cravings, and they can also help sort of normalize that pleasure pathway. Certainly, if you're a patient who has a problem with addictions and you're starting to say, wow, I didn't know there was a medication out there, talk to your doctor about it. And maybe your doctor can advise you that, well, actually, maybe it might be good for you, maybe it's not good for you. And so there are medications that are out there that can help in the disease of addiction.
And so what could family members best do to support, support members of the family who do have addictions? Like what, because I know that causes a lot of friction. This is a family disease. So what would you recommend to family members?
Family members, I would say, definitely need to support the family member, while at the same time not enable the addictive behavior. Mm-hmm. And that's a very delicate balance to walk. And if the family member says, I want to help the person and I don't know how to help the person, the family member can also seek help. The family member can, I mentioned Alcoholics Anonymous, the family member can go to Al-Anon. Al-Anon is an organization, a sort of a sister organization of Alcoholics Anonymous, but not directed at the patient, but directed at the family around the patient. Again, the family member can seek help at one of the Centre de réadaptation. Sort of at the very basic level, though, I would say that in terms of supporting the individual, if the person has a problem with alcohol, don't drink alcohol in front of them. If the person is struggling with cannabis, don't smoke cannabis in front of them. If you have two people and one person has a serious addiction to tobacco and the other person, or to cannabis, and one person says, actually, I don't have an addiction to cannabis, but I'm going to smoke in your face, that's not being supportive of the individual. Maintain dialogue. Express your concerns to the individual. I'm worried about your substance. I see that you're spending a lot of time doing this. I see that every time that I see you, you smell of that. These dialogues can take place. And in essence, these are things that can be done that might help.
Mm-hmm. And can you explain the concept of triggers? And so let's say somebody, like for instance, now during the pandemic, people are, drinking earlier, people are confined. What would be some triggers? And then could you also recommend some coping strategies? So let's say people are right now, let's say right on the cusp of where that coping mechanism may have the potential to become addiction, what would be some strategies for you that you recommend to just put a stop to it?
So when we talk about triggers, there are two types of triggers. There's the triggers that are very specific to the individual. That is, every time I meet that person, I relapse. Every time I have a conversation with that person, I relapse. Every time I smell something, I relapse. Every time I'm in a certain aisle in the grocery store, I relapse. Every time I walk by that store, I have a trigger and I want to consume. So these are very specific to the individuals. There are global triggers, though. AA has an acronym, HALT. So hungry, angry, lonely, tired. So if you find yourself in a hungry environment, that is, I want to eat, I'm hungry, your chances of relapse, you're moving into the yellow zone, into an orange zone of risk of relapse. If you find yourself angry, or I'm just going to say emotional, it could be a good emotion, it could be bad emotion, it could be stressed, anger, frustration. You're moving into that yellow-orange zone. If you find yourself lonely, if you're by yourself, that's also moving into this yellow-orange zone of risk of relapse. And if you find yourself tired, you're also at increased risk. Your defenses are down. You're at increased risk of relapsing. Now, COVID kind of nailed us 3 out of 4. So we find ourselves kind of scared, angry, emotional, frustrated, and all of those things going on at once, because we've got this virus going around that's could kill us. So we've got this emotional side, we've got the angry side. Then we say we're going to all be socially isolated. So stay away from everyone else to keep yourself safe. So now all of a sudden you find yourself lonely. And you're spending all your time online, so you got a lot of screen time, lots of blue light. You can't go to the gym anymore. Your sleep gets knocked out of whack. So now you find yourself tired. So right off the bat, COVID gave us 3 out of 4 of these common triggers. And if you've been laid off, if you lost your job, and if you have financial insecurity, all of a sudden food insecurity starts to be an issue, and that hunger factor starts going in. So COVID could nail you 4 for 4. Now, the question that you've asked, the other question you asked is, what can you do faced with this? So what's the expression? Early to bed, early to rise, makes you healthy, wealthy, and wise. So, but seriously though, respect your body, respect your life. That is, get up at a reasonable time. I don't care what time you go to bed at, but force yourself to get up at a regular time. I don't care if you have nothing on your agenda. You have to get up at a regular time. Move. Movement is so important. And if you're not on quarantine, get outside. Sunlight is important. So get yourself outside, get yourself in sunlight, move. Respect your diet. And that doesn't mean follow a military regimen of what you should eat. Eat reasonably. This probably isn't the best time to say, I'm going to go on a grapefruit diet, or I'm going to go on a whatever fad diet I want to do. It's probably not the best time to do that. Listen, if you want to snack, snack. If you're going to eat, eat. For somebody going through alcohol withdrawal, or somebody in the initial settings of stopping to drink, usually I'll say, look, I don't care what you eat. If you're hungry, eat. You want a snack, snack. You want a chocolate bar, have a chocolate bar. I don't care. It's all good, because that deals with that hunger aspect. Sunlight is important. If you are on quarantine and you can't get outside, move inside, go up and down stairs, do push-ups, do curl-ups. Physical activity is so important. FaceTime, Zoom, talk to people, give somebody a call, break the isolation. And if you can deal with these aspects in terms of coping strategies, these are all, I would argue, much better coping strategies than, say, I'm going to sit down and smoke my joint, or I'm going to sit down and drink my alcohol, or I'm going to sit down and snort my line. These are not good coping strategies.
I think for me personally, I think the most important step that I needed to take was to admit to myself finally that I had a problem, and, I was never somebody that drank during the day, but it was like every night at same time. And like you had mentioned earlier, like, the 2 glasses became 3, became 4, and, I think there's a big stigma to say, oh, I actually have a problem. And it took hard work. It definitely took support. And then there's all those firsts, right? So like my first Christmas without the champagne or without the wine. But I think the rewards of just sitting in my emotions and feeling, I mean, it's the first time in my life I'm actually feeling. and probably feeling the best that I've ever felt in my life. But it does, it's a daily, takes a daily struggle. It takes a lot of work, but I think that the rewards pay off, but it's not easy. And I think that, like, again, I think what's most important is just to be able to say, not feel shame, or reach out to your good friends, or reach out to your family to say, okay, I need help. But a lot of people feel this shame, and I feel that the more vulnerable and the more authentic you are, it's really the first step. My last question would be, is in terms of COVID, how has the pandemic impacted support services? So, like, could people receive virtual support? Like, how do people get help?
So I think COVID has kneecapped just about all health services that are around, be it addiction or non-addiction services. Within the addiction world, we've done what we can in terms of adapting to our reality, be it a changing in staff, a changing in number of beds that are available, and also the physical, can we do this by Zoom? Can we do this by telephone? Do you physically have to come in? And so there are adaptations that have taken place. In terms of how has COVID directly and materially impacted on our patient population, if you're a patient who's if we have a large number of our patients are homeless or are itinerant, a lot of shelters have fewer beds because of the whole COVID pandemic. Some shelters have been shut down because of the COVID pandemic. If there's an epidemic going around, an outbreak going around within a shelter, the shelter might get shut down. From an overdose standpoint, the number of overdoses have gone significantly up. The number of fatal overdoses of substances has gone way up, in part because we used to say, if you're going to use a substance, at least use it in the presence of somebody else. And then if you have an overdose, the other person can call 911, the other person can give naloxone. But if you're using it by yourself, no one's there to call 911 for you. And so we are seeing a significant uptick in overdose deaths as well. In terms of just a comment on your stigma aspect, absolutely, there is unfortunately a strong stigma associated with addictions. I would say that, if you walked around and said, actually, I have diabetes, or I have hypertension, or I have lung cancer, or I have COPD, or I have Crohn's disease, there's no stigma associated with these diseases. Okay, you have it, and what else we're going to talk about? But you're right. When someone says, well, actually, I have an alcohol problem, all of a sudden, whoa, that's different. You have an addiction problem. Oh, that's different. The reality is that it's not all that much different from all the other diseases that are out there. And slowly, I think that we've come a long way from a societal standpoint to evolve from being, this is a stigma, this is a bad thing, it's your fault, to it's a disease. And yes, there's an aspect of an individual aspect, a community aspect, a political aspect, a social aspect, an economic aspect, a religious aspect. It goes on, and it's sort of this comprehensive disease that kind of got lots of fingers in lots of different pots. And that once we start addressing this, that we can start saying there's less of a stigma, and yet just any one other disorder that's out there.
Well, thank you very much for taking the time today. And we're going to, I'll be in touch. We're going to be putting a list of resources on our website, on the McGill Dementia Education website, so that people could go and see where they can get some support. But thank you so much for being on our show today. Really appreciate you taking the time.
Thank you.
Please join me next week, Wednesday, January 27th, and the topic will be living with and caring for a loved one on the autism spectrum. My guest will be Dr. Julie Skora, Assistant Professor in the Department of Neurology and Neurosurgery at the Faculty of Medicine and Health Sciences, and Associate Director of the Israeli Center for Autism Research. Dr. Skora will speak about autism disorders, their signs and symptoms, how they are diagnosed, and available treatments. So this webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. Once again, I would like to thank the Lindsay Memorial Foundation for supporting today's webcast. If you would like to make a contribution to our program, please visit us at mcgill.ca/dementia. And if you have any questions or topics that you would like us to discuss during our webcast, please email us at dementia@mcgill.ca. Until next week, take good care of yourselves and your loved ones. Thank you for watching.